Good morning and welcome to our November campus update. I'm pleased to be able to recognize some faculty members and staff at the university, as I usually do when we begin these updates. Dr. Feng Dong, Ms. Nicole Ammon, Ms. Hannah Haney, and Ms. Jessica Zavala, together since the last update, and I don't think it's been quite 4 weeks since that period of time, we brought in almost an additional $300,000 in external funding to support our programs at the university. Yes, well worth an applause. Thank you very much. I'm also really pleased to recognize Dr. Nancy Gant. Dr. Gant has been associated with this university for a very long time. She is a well-respected surgeon nationally, and she was just recognized as the first vice president to the American College of Surgeons. That is a national organization that represents hundreds of thousands of surgeons across the United States. This is really a prestigious post, and it's a stair step towards becoming the president of the American College of Surgeons. So a big shout out to Dr. Gant. Thank you. And other great faculty members, Dr. Lunny, who has been the clerkship director at Mercy St. Eve's for over 30 years, was just recognized as a master teacher by the Ohio chapter of the American College of Physicians. So congratulations, Dr. Lenny, also. So thank you all for Casino Night. We weren't able to do Casino Night since 2019, and it was really a culmination of our 50th year, a celebration for all of us to come together to recognize the achievements of the university over those first 50 years and just celebrate our chance to come together and have fun. And I think we did that. I think it was an incredible success. A big thank you to the advancement team and all of those who helped to do this. We raised about $350,000, and Mr. Paul Bishop, one of our former trustees and currently a serving trustee in an unofficial role at the university, got up and announced that he would donate another $100,000 that night. Is an incredible supporter of the university. I love the zebra striped coat that he came with that day. It was very festive. I think people had a great time. And I know we sold out. So I'm sorry to those who weren't able to come. We had over 500 people buy tickets to this amazing event. And Dr. Fleckerman was the winner of the then 5, but now extended to 5-night stay at the oceanfront condo in Maui. So congratulations to Dr. Fleckerman. So this was a little bit of a drag-out, kick-down fight across the university for who was able to walk away with the trophy for the Halloween decorating contest. And though I know that many people in the room feel like the fix was in, the reality is it was a good, strong competition. And so hats off to the provost office, who has now won this 2 years in a row, with special mention to the Family and Community Medicine Department, who also was recognized for their Addams Family theme element. There's always next year to the president's office, who was feeling like they somehow got displaced, and there was a fix in place for this. But congratulations, and thank you all for making it a warm, warm week for our students who really, really enjoyed this event. This is a tough time of year for our students, and it's gone by so quickly. Seems like just yesterday we were coming together and welcoming our students back on the campus. But in fact, here we are approaching the end of November, and just barely into December, they'll start taking their finals before heading off into winter break. So this is a stressful time for them. And Student Services always does an amazing job running the De-Stress Fest. That is taking place this week. If you see our students walking around enjoying some of the activities and the refreshments that'll be available to them, please reach out, give them your support. This is a very, very difficult time. We run only doctoral and master's degree programs at this institution, as you know, and it is not easy. Many of you have been through it. Think back to those days. It's easy to forget just how stressful and difficult those times were. We're also having a celebration of winter. This is a gathering of people from across cultures at the university, faculty, students, and staff. Last year it was held out in the bottom of the news center by the fireplace. About 100 people showed up to talk about how they celebrate, based on their culture, some of the many, many holidays that take place in November and December across the globe. And so I encourage you to attend, and that'll be taking place at the same time as the Student Research Symposium, which will be upstairs, so it'll be a very packed time in the News Center at this university. But December, as you can see, it's a pretty incredible time of celebration across the globe, from Kwanzaa to Christmas and Hanukkah, and let's not forget, it's not on here, Festivus for the rest of us, those of you who are fans of Seinfeld. But it is a really incredible and meaningful time. And our holiday period really has already started. Although many of us think about Thanksgiving to New Year's, in fact, our students just had an incredible celebration of Diwali on Friday, which is the Festival of Lights. Some would say it's akin to a Christmas celebration for many in the world, very heavily celebrated in India and in Nepal. We also want to thank those in the decorating committee. If you notice that the News Center is always well decorated for the holidays, and that's Signet, the people who help run this organization for us and with us. But the rest of the campus has had a lot of activity and decorating going on, and there are people in this room and those who are not in this room who contribute to that to make it a festive and really spirited time of year for all of us. And so a big thank you to them, because this is not something that they get paid to do. This is something that they're doing to try and improve our community, and that really means a lot. We have a student research symposium this Friday that'll be going on most of the day from 1 to 5. You will have 156 NEOMED students from medicine, pharmacy, graduate studies, coming together and presenting the work that they've been doing with our Rootstown-based faculty and our clinical-based faculty. And this will be a wonderful day to look at posters and to hear some platform presentations. The students run this. The students put this together because it is so important to them, and we are helping to create their futures in healthcare, and in doing so, partnering with them to teach them how to improve and not just practice the status quo of healthcare through research activities. A big thank you to the deans, the provost, and of course to the vice president of research for helping to support this activity. We also have 2 key hires that are going to be taking place soon, really 3, but 2 of them that are going to be very quickly taking place, and that is our new director of library services. There's an opportunity for all of you who wish to attend, to hear from the individuals who are applying, and to weigh in so that we can be sure we get somebody really powerfully strong and collaborative in this position, because library services affects all of us across this campus. The other one is the Director of Research and Assessment. We've been fortunate to have a talented individual who's been with us a very long time at this university. Certainly can't be replaced, but we're looking for somebody who can come in and help us to grow and to fill Bob's shoes. So an opportunity for you, please take advantage if you can. The third one, which we have not, we're not that far into the search yet, is a new director of human resources. And of course, that impacts all of us across the institution who are employees here. We've been doing a lot of community town halls, either myself and the provost, or for those who are not academic in the colleges, it would be me and Mary Taylor, our senior vice president for finance and operations, and our provost. And those town halls have really revealed a lot. One, that we've done a lot over the last few years to really improve things for everybody on this campus. I think morale is overall up. I think we shared the message that our students find the faculty and the staff at this organization, the number one thing that stands out as being great. And that was what came out of the surveys, and that's what came out of the student town halls. They truly appreciate everything that you do for them. We also learned about problems. So with our faculty, the faculty workload policy turned into something it wasn't supposed to be. And so we've listened, we've already met with them again. It is being revamped, not necessarily the content, but its implementation, so that it's not a burden to our faculty. It was never intended to be, but it somehow became something it wasn't supposed to be, and that is being addressed. We also heard from staff, the first group who met with us, about half of the staff of this university, about concerns on the LEAD program, which is the annual evaluations program. We will be having another meeting December 3rd. That's a follow-on with the other half of our staff at the university. We're going to take that information. We've heard from you. We're going to use it to shape the things that you are affected by on a daily basis, including the LEAD program. But we want to make sure we have everybody's input, we have all the information before we make any changes that could have unintended consequences of making things worse, or maybe not fixing the problem that you were hoping that we were able to fix and put into place. Your chances to do this are even greater than just what's been based in the town hall. And I think all of you know we're working with the Strategy and Transformation Office to do a refresh of our strategic plan. It has been our North Star for the past 4 years. And it's called a 5-year plan, and that's what the board had approved us for, was a 5-year plan. And their endorsement was critical to making sure we had the resources necessary to achieve what was laid out in that plan. Well, we are at about 4.25 years through that process, and we don't want to wait until we get to September to say, how do we continue this on? Did we have the right priorities? What do we modify along the way? So our Board of Trustees is expecting us to give them a report in our March board meeting of what we would like to do for the next 5 years. And again, we're never stuck with what's in there. It's meant to be a living plan, but we need to give them the intent, the critical elements of it, without changing what we've done really well, but changing what we've learned from, or changing what our trajectory is in some particular areas. So you're going to get surveys, and I encourage you to please answer those surveys, because if you don't, your input can't be included. And the first strategic plan was totally built on the input from our community, and this refresh, this reshaping will be totally built on the input from our community, and that is first and foremost our employees here at the university and our students. The Vitals program has continued to thrive. I want to thank University Hospitals for sponsoring this program for us. It allows us to get this out in a bigger and better manner. Very much expecting this to be on the AMA Med Hub here soon, as Tanya from Marketing Communications has been leading the endeavor to get this out to a bigger venue, which would then get us visibility to over 600,000 people across the country. It's a really outstanding program, the AMA Med Hub, which will allow us to partner with our program like Vitals so more people see the great work that we're doing. Just going through the machinations of ensuring the contracts and agreements going back and forth are in place, but we should have this ready to launch pretty soon. Laura Adams is the Senior Advisor of Science and Technology Portfolio for the National Academy of Medicine. Really looking forward to an outstanding talk from her coming up in the next Vitals. Thank you to all those who come together to make this a special time of year through NEOMED's Holiday Store. That'll be in the News Center at 2009 to 2010. It's a chance for those of you in the area who are really interested in the holiday spirit and do crafts. It's a chance for people to come in and see the great things that they've made and an opportunity to acquire those things. And of course, we'll be celebrating together as an organization at what's being called Jingle and Mingle, which is our holiday brunch that we traditionally have. It'll be December 12th. It's an opportunity for Dr. Faison and Mary Taylor and I to come out and to serve you coffee and to serve you food and to recognize all the great things you've done with us and for us at this university. It's just some downtime for all of us to come together. I encourage you to mix your tables up. Too often we come to these types of events and we sit with the people we work with. Well, you've built a great relationship and have a great family in the areas you're with. I'd love to see more of you interact and learn more about the other people at this university. Some of you do it routinely, others we don't. It's just a chance for us to relax and to drop our guard and really spend some time getting to know the people that we work with across this campus. The university team has determined that this year the holiday giving would be for the Portage Animal Protective League. So any donations you wish to make will be given on behalf of the university. It's a really great cause, so I encourage you, if you're able, to be able to do this. And then winter break. I know we publicized this, but working close with Janet Kuhn, who's also the secretary to the Board of Trustees, we've been able to map out a holiday break period that only would require you to take 3 instead of the traditional 4 paid time off days to make it a complete extended break period. The Board of Trustees authorizes my position to be able to give you extra days during the holidays. And of course we did. And so it'll be December 30th, 31st, January 2nd and 3rd, tying that to the holidays, which will be the 24th, the 25th, and January 1st. You can add 3 more and have a very extended break to travel, to enjoy time with your families, or to just depress. The Cleveland Cavaliers, I understand, are outperforming the Cleveland Browns 15-0, right? 15 wins, 0 losses, pretty amazing. Big thank you to our human resources team who's managed to arrange for a bit of a NEOMED night at the Cavaliers game to get you reduced tickets. Should you have an interest in going, contact human resources. And then I want to encourage all of you to please, once again, participate in the strategic plan surveys. We're also doing focus groups. Lacey and her team are leading this. We're also working with Tomorrow's People again, as we did last time. It's really that third party coming in to create that barrier so that when you're responding, your answers are going to somebody outside of the university. So we're not seeing who you are. We're not seeing what you had to say. They're taking that information and compiling it for us so that we can act on it along with their recommendations. So thank you all. I do ask that you please do this. Otherwise, really great time of year, incredibly busy. Holidays are coming up. And as I said, the holidays have already started with Diwali moving all the way through to New Year's. This is a time for celebration. This is a time for all of us to spend time with our family, our friends, and our community. And as I always say each year, and I'm going to emphasize this again next month, remember people who you work with and in community who may be alone, or individuals who don't have somebody's home to go to for dinner, for lunch, for celebration. Open your arms, support each other, and make sure that all of us have a friend, especially during this time of year. With that, I'll stop and take any questions. Any from the group here in the live audience? Then I'm going to start with some of them that are online. Any updates on soundproofing the new student lounge? We're going to keep hearing about this until we get something done. In the College of Pharmacy, as mentioned previously, there's a lot of noise from that. Right now, Mary, I don't think there's a solution in place. Is that correct? Just to be honest, there's not a solution in place. We will have Dale look at potential opportunities for us to use movable barriers to try and help soundproof. I understand it can affect the work areas. On the bright side, it means our students are loving the space and they're having fun. I think mostly what you're hearing is the noise from ping pong tournaments that are going on. It's hit or miss. We have been monitoring the space, and most of the day, there are not a lot of people in there using it, but I know there are some break periods where that occurs. I don't have a solution for you yet. We'll rely on Dale and team to see if there's something we can come up. Dale's in the back of the room. He's trying to hide his head, but there he is. But we will work on it. Thank you for sharing the upcoming research committee items. What is your philosophy on succession planning for leadership roles such as managers and supervisors of staff? There are many key roles up for retirement, especially under the university's shared services in the provost office, or that have recently retired, have had positions eliminated, a new job posted. There have been mentions of looking for duplicative services within colleges and departments to level shared services. Other than recent surveys that have launched, are stakeholders like those reporting to other people being engaged in the process? The answer is yes. The Strategic Planning Committee isn't just looking broadly, they're doing more in-depth focus questions for what they're calling engaged stakeholders. I think engaged is the term. Informed stakeholders. So yes, we are doing it. And yes, we are very well aware of some of the big losses for people who've decided after many, many, many years of service that they have to retire at some point. I'm looking for one in the room specifically and don't see her, but she will be a massive loss to us as a few others. So we are planning some period of overlap, and Dr. Faison, as you noted in the provost office, is arranging for that overlap and determining when he's going to sequence job postings. But yes, we will ensure that there's adequate staffing and overlap. That is critical to us. Our students need to be able to have the support that they want in place, and our faculty need to be able to have that support especially for research and for faculty development. There are several key roles university-wide vacant. This is the same kind of question. Information technology example, and survive when sickness or vacation comes. How are you monitoring this or looking for to support current employees before burnout occurs? People quietly quit or leave NEOMED to go to other places. So we've not had a big churn at this university, especially when we're comparing it to our peers. Now, our peers have the other issue of not just churn, meaning people coming and going, whether it's finding new jobs because it's a better opportunity, maybe it wasn't a good fit for them, or it's time for retirement. But we're not downsizing at the university. In fact, we're upsizing. And in this last budget, we added a fair number of new positions to the university. And the next budget, we will be doing the same thing to be able to support the growth in the colleges, but very importantly, the growth in the University Hospitals Partnership, as they're going to be giving us more dollars to support activities we're doing together. Monitoring burnout is always difficult. We rely on our frontline supervisors for that. We have NEOMED healthcare with services available for behavioral health, mental health, wellness. We put on activities. We spent a lot of time talking today about the activities on this campus. De-Stress Fest is for everybody on this campus. The winter break periods that we're putting into place, the holiday brunch that we have in place. There are many things that our team in HR and student services are putting together to try and address those issues. And that's exactly what we're doing through these town halls that Dr. Faison and Mary Taylor and I have been doing. With the rising healthcare costs, couldn't faculty and staff that are based here on campus be given the benefit of use of Sequoia Wellness as preventative health? It is fully a benefit, not with monthly costs. So we also got this question during the town hall. So back when we were self-insured through MedMutual, there was an opportunity to go over there and either have a free or reduced cost in that space. In doing so, the university, as I would say, as we transitioned from MedMutual to being fully insured now, most of the health and wellness initiatives are supported by our insurer. SUMA right now, it will be Altman here after January 1st. And the way I answered the question to the individual who gave this to me last week during one of the town halls is, it's a balancing act for us. So we have to pay for those Sequoia memberships. And NEOMED owns the building, but Signet runs Sequoia. So I go over there and I pay my monthly membership dues to do so. When the students go over there, we pay their monthly membership dues to do so, but they pay a student fee to pay for it. So the students are covering the cost. And there's one pool of money. So if we use those dollars to do that, and I think Mary said it was about $70,000 a year in the past to do so, that means there's $70,000 left to distribute out across raises at the university. So we had to make the decision to remove that and to do this instead. To go with a 1% increase for just the staff at the university runs somewhere in the neighborhood of $365,000. So that $70,000 is, you could look at that as a 0.25% increase in pay for everybody, who then can decide to use their dollars if they want to go to Sequoia or not. So we made the decision to do that. The other one I brought up at the time was we have the educational benefits. And we didn't really touch those for the lower echelon compensation employees, but we did say those who were making higher dollars had to contribute a little bit more, but we did keep it in place. That program cost several $100,000 a year to run. We didn't touch it because there were a lot of people concerned saying, leave that alone, that's the reason I'm here at the university. The alternative would have been to get rid of the educational benefits, because unlike Kent State and Akron and Youngstown, where it doesn't really cost them anything, they just say you have to come to our university, and sure, you can have a seat. They already have the seats. We actually pay for it. So the cost of it would have been an additional 1% increase to pay for the staff. That's the balancing act that we have when we look at how we utilize resources. And it's a resource where it's benefiting the few, not the many, but the few were about, I think it was about 6 to 7% of individuals uses the educational benefits. But it was a trade-off, and it was one that we made, and we're always willing to revisit it. But because there's one pool of money, anytime we put resources outside of compensation, it pulls a little bit away from compensation. So that a long-winded way to answer your question, just so you know what we go through and what we were thinking. Would our community ever look to become more of a 24/7 open facilities place, allowing for flexible schedules and further hiring for sustainable support of students, and not just having 8 to 5 business hours coverage for a small team? We can enhance the exceptional student experience that way. I'm not sure our students would use the facility 24/7. If they're here on weekends, they tend to want to just come sequester themselves and study. We're not big enough to be able to run operations 24/7, because if we did, we'd have to hire a lot more people, which would mean we're taking the dollars that we make and spreading them out across more individuals. And then there's the increased costs of maintenance and operations. And of course, that includes electricity and heating and lights. Police force would have to be increased during the evenings and weekends relative to where it's at. So it's really, while I understand what you're saying, we're not a hospital that needs to be open and serving patients 24/7. Even urgent cares across our community don't typically stay open after 8 p.m., some of them 6 p.m., because of the cost of running operations. To do that, I don't think we could survive financially in the position that we're at right now. With more changes coming to faculty workload policy, what is the plan for faculty and overload? So there isn't really a change to the workload policy so much as the way it's implemented. It was never meant for faculty to have to track their time. Faculty are professionals. We don't want this to be transactional, where you're sitting in every year and filling out, well, here's what I did. We know what you do. And the workload policy says if you're a tenured track individual, you're going to spend 40+% of your time doing research. We have an expectation that if we need you to, you may spend 20% of your time doing mandatory service. And by mandatory, it's things that we have to do at this university to run our programs. So the CAP committee, the admissions committee, the IACUC committee, the RPT, tenure promotions committee. You have to do those at an organization, and it has to be faculty that do them. So we have to make sure that you have some time in your expectations for work to do that. And then, of course, teaching is really what pays all the bills at the university. nearly 100% of everything that is an operating dollar at this university is either tuition or state share of instruction. And the state defines state share of instruction as dollars to offset the cost of education. So we have to make sure that we have enough faculty to do the teaching, but we don't want to throw you an overload, meaning we know how many hours a week you're going to work. And instead of the 53 or 60 hours a week that's published nationally for university professors, we decided to use the more standard 40 hours a week. So if you get hired at this university and you're a tenured track faculty member, tenured track, you would say, if I work 40-hour a week, then I know 40% of my time is dedicated to just doing research. And nobody tracks that or monitors that. Your outcomes are reviewed by your peers. And for a tenure track, it might be 10% service. So you're going to sit on a couple of committees, and then your teaching time should not exceed 40% of the 40-hour week based on credit hours. This is how Ohio defines it. So there really shouldn't be a chance of you going into overload, because I've asked the deans to overstaff. We need to overstaff, because if you're staffed on 100%, somebody goes on sabbatical, somebody gets sick or worse, somebody decides to take a new position somewhere else, you're automatically shorthanded. So we always overstaff. And in fact, through the mechanism we went through recently, we looked at 1.6 to 1.8-fold overstaffing, which means if the chairs fairly and equitably distribute the workload, really nobody should even be coming close to that 40% of their time teaching. And as we looked at the numbers, if it is distributed equally and appropriately, that won't happen. So it's really not an issue, and we don't want faculty to have to look at it. That said, we're going to monitor and we're going to pivot over time. We just had a discussion this morning about national changes that are potentially on the horizon and state changes that are potentially on the horizon. I think it's no secret, if you keep abreast of the national news, the incoming administration is planning to use federal dollars to influence things like the potential for elimination of tenure. If they can do it at a national level, I don't know that it's achievable, but that was stated, as well as some of the other policies that are affecting us at this university at the state level. So faculty, I feel your concern, but right now we are an organization that has both valued tenured and non-tenured faculty lines, and the protections that were put in were based on some of our more prominent peers like Northwestern, rather than our local peers, who are actually, many of them, doing more than 30-hour credit hour equivalents, and almost all of theirs is teaching time, even for a tenured professor. How might the elimination of the Federal Department of Education, should that come, impact NEOMED? I will not expect that it is going to impact NEOMED. I think whatever is done may have more impact on undergraduate institutions. I don't really see that it's going to have dramatic impact on us. If indeed this administration tries to go towards elimination of tenure, which was a stated outcome for K-12, but it was also assumed to be an extension beyond K-12, then it really just flattens the playing field nationally. If it were just us, just Ohio, some would argue that faculty members would then leave to states that didn't eliminate tenure, if that were to occur. But if it's done nationally, it's really a flat playing field. So I don't see that it's going to have dramatic impact on us. We are already compliant with all the rules and the regulations. We work very closely through them to make sure that we're accredited so that we can get student loans. But we're not doing anything that would be a target right now for anybody at the federal level, so I think we're okay. But I can never predict the future. So there's one thing I can't predict, it's the future, unfortunately. Any thoughts on the cost of living increase? Our health care and JED takes away our raises. Well, if the JED only has an impact on you based on where you live. For most of us, it had no impact. And as Mary looked at the numbers, I think it was only about 5 to 10% of employees who weren't paying local taxes now have to pay JED tax. Again, wasn't the university. This was the local Rootstown leadership that did this. Not really within our control. and cost of living is affecting everybody nationally. Now, the good news is the cost of living increases for the last 2 years have been about, we just looked at this with the IUC, 2.54%, and the university gave higher raises than that. And in fact, we've been giving higher raises than that for the last 4 years straight. And we have outperformed every other public university and I think every private. We don't track them, but they're having much more difficult times than any others in the state of Ohio. So while I understand your concern, and I think everybody's concern, which was part of what really shaped the national elections, was inflation, cost of gasoline, cost of food. That's what we're hearing from surveys, that these were the key drivers, so you're not alone. And the university has done more than others have been able to do, but I'm sorry, I know it doesn't fix your problems, but we only have so many dollars to distribute, and our dollars all come from student tuition and from SSI, and we don't control SSI, the state legislature does, and they've already told us through the chancellor's office that to expect a 1% reduction from this year in SSI is going to be in the governor's budget for the next biennium. So can't control that. And then, of course, the state actually has pretty significant controls in place in what you can do with tuition. And our Board of Trustees, rightly so, is always looking at us to make sure our tuition doesn't go up too high and become too much of a tax on our students. That's the balance that we have. But we've been fortunate because we have been able to do pretty significant increases year over year for our staff. And our faculty, their increases are just based on what the national cohort is doing through the new faculty compensation plan. I know I get that question a lot, but we really are doing more than others are doing. I know it's tough times. We didn't control the JED. That was a decision that was done by the local leaders. You're always welcome to attend one of the Rootstown Township meetings and give them your input on this, but it was done to us, not by us. And I think I hit all of the questions online. Anything else here inside? No. Well, for those of you who didn't attend yet, we look forward to seeing you on December 3rd for the town hall. Our staff, really a great opportunity to hear from you. And until then, be safe and enjoy the holiday season that's coming upon us.